This PowerPoint presentation will include the benefits of an electronic health record system and health information exchange for the patients. Patient engagement is at the center of the electronic health records and the health information exchange. It includes becoming more involved in your care, and it's described as getting patients involved and in charge of their health care. It also allows for greater control of your health care and overall leads to patient satisfaction. So what is health information exchange? Health information exchange is described as information that is shared between providers, hospitals, and clinics to provide the best care in the most efficient manner possible. It also allows for access to your medical record and allows you the power to ensure all your health information and data is correct. And overall, it's a continuity of care between providers and facilities. If you were to go to the emergency room or a specialty clinic or were having surgery, all of your information would be linked, including your medications that you're on and your medical record history, which would allow them to provide the most effective care possible for your visit. So there are several benefits of this new electronic health record system and the health information exchange. Some of these benefits include, of course, becoming more involved in your care. It also allows for you to share decision making with your providers. If you have access to your medical records and your test results, this allows you to become more involved and help them make the decisions about what you want for your care. Also, patient activation, you have the ability to manage your health, and patient engagement allows for the involvement, for you to be involved in your care. So overall, health information exchange results in better quality care that is shared between all providers and healthcare facilities. So how can you become more involved in your care? We now have access to a patient portal, which is your medical records with just an easy access. You just obtain a login, sign-in information, and this allows you to review test results and your medical record history that you can review. You can make sure all your information is correct. You can also, we now have access to blogs, which are provided on individual provider sites and also on the hospital's main page. We've provided a list of frequently asked questions that are divided up into specialties and also general information about your hospital stay and what your experience will be like and what you can expect. And this allows you more access to information on questions that you may have forgotten to ask or questions that may have been missed. Also, we have started our new telehealth, which also allows for questions and communication among patients and providers. There are several different ways that you can ask questions. If you're having upcoming surgery, you have access to telehealth, up to a month before your surgery and a month after discharge. And this allows for any questions that you may have regarding your surgery, common concerns after surgery, which allows for you to not have to be readmitted to the hospital or emergency room visits or even physician visits when your concerns may be minor concerns that are very common that you can, just ask over this telehealth portal. Also, the telehealth allows, if you are discharged from the hospital and you did not understand all of your instructions, you can have access to communication with providers and nurses, and they will answer these common questions. And also, if you just have general issues and concerns with various health questions or issues that are going on, you have access to telehealth, which can answer these questions. So there are also new methods of communication. Of course, we just talked about the telehealth, and there's also blogs that are available, which these include the frequently asked questions, and also this is patient information that's shared between various patients who may have gone through or experienced different things that you're going through, and you can share medical information this way. That also there's various ways to remind you of your appointment. They do not just have to include phone calls. You now have access to give your provider, they can text message you or also email you, which also saves time, and since most people use email these days, you do not have to receive several phone calls reminding you of your appointment. So of course your visit is going to change with the new electronic healthcare record system. So the sign-in process is going to be a little bit different. Instead of signing in with a piece of paper, there's going to be a kiosk in which you will sign in when you get there, which also leads to fewer wait times. The check-in and check-out process is much faster. Of course, this is new to everyone, so there will be staff available to help with this new system. Also, your visit with your physician will be different. During your visit, your physician will be using a tablet in which he or she will input your medical record data into your electronic health record, which also allows them to print your prescriptions electronically. And they have access to your lab information and all your past visit information right there on their tablet. Also, the discharge process is sort of like the sign-in process. It's a touchscreen kiosk in which you will sign out, and it gives you the option to make an appointment, or we can remind you when your next appointment may be. So your experience will also change, hopefully for the better. You will have better communication with your physician, as he will have your electronic health record medical history sitting right there in front of him during each visit, so you can access all your old information right there if there's any questions. Or you also now have, of course, the patient portal access. There's now an option you can, or we can email your discharge instructions instead of just giving you paper copies. Of course, the health information exchange, in which all of your health record history and medical records are available across all providers, hospitals, facilities, pharmacies. And this leads to more information that's available to you and available to your providers, which will allow for the best care possible. So in conclusion, of course, the overall goal is patient satisfaction, which is found to be true with the new health information exchange and the new electronic healthcare record system. It allows for greater control of your health care, which allows you to be more engaged with your providers. There's also better health outcomes, which leads to lower cost because of fewer readmissions with the new telehealth and the blogs. And also you have access to your health information and access to health personnel for any questions. This concludes the benefits of the electronic health record system and the health information exchange.